Did you know that 1 in 3 people will face cancer at some point in their life? But here's something many don't realize. Every year, millions of cancer cases are diagnosed too late simply because people miss the early signs. According to the American Cancer Society, diagnosing cancer at stage 1 can lead to survival rates above 90% for many common types. But if it's diagnosed at stage 4, that number can plummet below 20%. In this video, I'll highlight 8 subtle warning signs that could literally save your life. These aren't the obvious symptoms you've probably heard of. They're quiet signals your body might send before things become severe. Unfortunately, many people overlook these signs, but identifying them early could make all the difference. Now, I know what you might be thinking. Every little symptom online seems like cancer. That's exactly why this video is different. We're focusing on signs backed by science, not online speculation. These are the kinds of indicators that have helped thousands with early cancer diagnosis, allowing treatments to be most effective. Stick with me, because this isn't about fear. It's about empowering you with life-saving knowledge. Let's get started. Number 1. Bone pain. One commonly overlooked warning sign of cancer is persistent bone pain. Unlike the temporary soreness from exercise or minor injuries, bone pain related to cancer tends to worsen over time, especially at night. Cancer that begins in or spreads to the bones disrupts their structure, causing a deep, intense ache that's hard to ignore. Osteosarcoma, a type of primary bone cancer, often affects the long bones in the arms and legs. At first, the pain might feel like a minor sprain or muscle ache, but it gradually becomes more intense and constant. This can interfere with everyday activities, making even simple movements more difficult. Patients often describe the pain as throbbing or unrelenting, and it usually doesn't respond to common pain relievers. If your bone pain comes with swelling, tenderness, or fractures without a clear cause, it's essential to see a doctor. Early detection of bone cancer significantly increases the chances of successful treatment, with much better outcomes when diagnosed in the early stages. Eye pain. Your eyes can reveal a lot about your overall health, including potential signs of cancer. Ocular melanoma, though rare, is the most common eye cancer in adults. Its symptoms often start subtly, but can develop into noticeable issues that shouldn't be ignored. When cancer affects the eye, it may cause symptoms that stand out from usual eye conditions. These can include persistent blurred vision that doesn't improve with glasses or strange flashes of light unrelated to migraines. The most concerning sign is a dark spot on the iris that slowly grows or changes in appearance. Advanced imaging tools like ophthalmoscopy allow doctors to examine the inside of your eyes. If you have lighter-colored eyes or fair skin, your risk for ocular melanoma may be higher. Don't dismiss ongoing eye pain or changes in vision. Early intervention can protect both your vision and your life. Regular eye exams are especially important if you have risk factors like prolonged sun exposure or a family history of eye cancer. Number 3. Body rash. Certain skin changes, like specific rashes, may indicate an underlying issue such as leukemia. This type of cancer, which affects blood and bone marrow, often shows skin-related symptoms that many mistake for minor conditions. One key symptom is petechiae, tiny red, purple, or brown spots on the skin caused by a lack of platelets. These spots are usually 1 to 2 millimeters in size and don't fade when pressed. They often cluster in areas like the ankles or near tight clothing. Leukemia disrupts the body's ability to produce healthy platelets, which help prevent bleeding. Without enough platelets, small blood vessels can leak, causing these spots to form. Unlike typical rashes, which may itch or fade in days, these spots persist and are often accompanied by symptoms like unexplained bruising or bleeding. Fingernail marks. Subungual melanoma, a type of skin cancer that occurs under the nails, often begins with a seemingly harmless streak. Known as melanonychia striata, this vertical dark line on the nail should be closely monitored. Unlike natural nail discoloration, cancer-related streaks often appear suddenly and evolve over time. The thumb and big toe are the most common locations, but it can develop under any nail. Unfortunately, it's easy to mistake this for nail trauma or a fungal infection. Warning signs include streaks wider than 3 millimeters, multiple colors within the line, or blurred edges. One critical sign to watch for is the Hutchinson sign. where the pigmentation spreads beyond the nail to the surrounding skin. If you notice streaks along with nail splitting, pain, or bleeding, don't delay seeking medical advice. Number 5. Unexplained night sweats. Waking up drenched in sweat, with soaked bedding and clothes, might mean more than just a warm room. When these episodes happen repeatedly and aren't linked to menopause or environmental factors, they could point to lymphoma. Recognizing the difference between normal sweating and serious night sweats is essential. Night sweats caused by lymphoma are often accompanied by other B symptoms, which play a significant role in diagnosing cancer. These intense sweats usually occur alongside unexplained fevers and weight loss, forming a pattern that doctors find concerning. Your body produces these night sweats as it works to combat cancer cells. This happens because lymphoma impacts your lymphatic system, prompting the immune system to release inflammatory chemicals that disrupt your body's temperature regulation. Occasional sweating at night is common during stress or illness, but frequent, drenching episodes that leave you soaked should lead you to seek medical advice. 6. Persistent heartburn. Chronic heartburn, also known as gastroesophageal reflux disease, GERD, may seem like a minor issue. However, if it continues despite lifestyle changes or medications, it could be a warning sign of something more serious. Esophageal cancer can often present itself as persistent acid reflux that doesn't improve with standard treatments. The link between chronic heartburn and cancer lies in the damage caused by stomach acid over time. This acid can alter the cells in your esophagus, leading to Barrett's esophagus, a precancerous condition that raises the risk of esophageal cancer significantly. Pay attention to signs such as trouble swallowing, food feeling stuck, or unexplained weight loss in addition to heartburn. If you've been using over-the-counter heartburn treatments for more than 3 weeks without relief, it's time to consult a doctor. 7. Jaundice, where the skin and eyes turn yellow, occurs when there's a buildup of bilirubin in your system. While various conditions can cause jaundice, its sudden onset in adults is often a warning sign of pancreatic or liver cancer. In pancreatic cancer, tumors may block the bile duct, preventing the normal breakdown and removal of bilirubin. This causes bile to enter your bloodstream, leading to yellowing of the skin and eyes. Initially, the color change may be subtle, but it tends to become more noticeable as the condition progresses. The pancreas is located deep in the abdomen, making early cancer detection challenging. That's why spotting jaundice, especially if it's accompanied by upper abdominal pain, dark urine, or pale stools, is critical. 8. Fever. Unexplained or persistent fevers could indicate blood cancer. Unlike typical fevers that fade within days, those linked to cancer often follow a distinct pattern and come with other symptoms. Leukemia and lymphoma can cause your immune system to release cytokines, triggering frequent fevers. These fevers might happen without an obvious infection and often occur alongside symptoms like night sweats or sudden weight loss. The fever may spike at regular intervals, a phenomenon called cyclic fever. If a fever lasts more than 2 weeks or keeps coming back without a clear reason, it's important to get it checked out. Blood cancers weaken your immune system, leaving you prone to infections while also directly causing fevers. Blood tests can help identify abnormal cell counts or other signs of disease. Remember, early diagnosis greatly increases the chances of successful cancer treatment. Although these signs don't necessarily mean cancer, they should be taken seriously and checked by a healthcare professional. Thank you for watching this video. Please give it a thumbs up and share it with anyone who could benefit from this information. Don't forget to subscribe to our channel for more health tips.